I'm Mark Henderson from the Wellcome Trust. Welcome to SDG Live from Davos. I'm here today with John-Arne Rottingen, who is the Chief Executive of the Coalition for Epidemic Preparedness Innovations, CEPI, a new organisation that's launched at the forum today in order to help to prepare the world against epidemics by developing vaccines against those threats we can predict and vaccine technologies that we can deploy against those threats we can't predict. Welcome, John-Arne.
Thank you.
Tell me a bit about the background to CEPI. Why is an initiative like this needed?
I think the Ebola outbreak really demonstrated why we need CEPI. And the Ebola, by being a devastating kind of health crisis, but also having impact on the social dimension of societies, schools being closed, and really the economy is going down, and a big security issue. It really demonstrates the connections of health to other parts of other sectors, other parts of society, and we need to have a whole society sort of perspective on crises like that.
And in the case of Ebola, we could really plausibly have contained that epidemic much earlier if we'd had a vaccine. Why didn't we have a vaccine, and what happened to address that?
No, exactly. And we tested vaccines during the Ebola outbreak, but we started that testing by actually first-in-man studies from the August-September 2014. If we had done the necessary preparations to do phase 1 and phase 2 trials ahead of the epidemic, we could really have gone in, done large trials that would both really give us the evidence that the vaccine would work, which we now have evidence from the Guinea trial, but also contribute to controlling the outbreak and controlling the Ebola epidemic. And we have made calculations indicating that we probably could have started 6, maybe even 9 months earlier if we had been prepared, and we would have saved thousands of lives, we would have reduced the epidemic, and we would have not seen the devastating impact on 3 large countries in West Africa.
And of course that impact was not just the health impact through Ebola. If we think about the context of the Sustainable Development Goals, there's also the much wider impact on public health generally that an epidemic like that has.
No, exactly. And as I said, the schools were closed, and probably, and we don't have the numbers, but probably the Ebola outbreak had more impact on the health consequences we could not address due to the failures of the health systems that became even worse, of course, during the Ebola outbreak, because every effort needed to focus on Ebola. So really, we see how health is related to the general kind of dimensions on poverty and sustainable development.
So tell me more about CEPI. Who is behind CEPI, and what will it do?
Now, CEPI is really a coalition. It's a coalition between governments and foundation when it comes to the funding side. It was initiated here in Davos last year through a planning meeting. The World Economic Forum has played an important and is playing an important convening role. So the coalition is a coalition on the funding side, investor side of foundations, governments, but then on the implementing side, it's really both big companies, big vaccine manufacturers, it's biotech industry, but it's also public academic institutions that need to implement and do the necessary clinical trials. And it's really needed because there is no commercial market for vaccines like this, because we do not know when the next outbreak will hit, we do not know when we need a vaccine, we do not know where it will hit and what pathogen it will be. So that's why we need a planned and effort like this to be prepared and collectively invest. And in many settings I call this global health insurance mechanisms, because no country will know whether they will be hit, and by actually investing together, it will be a way to secure R&D for preparedness and response during outbreaks.
Now, CEPI will look after some of these known threats that we can predict today. We've announced today what some of those are. Talk me through those diseases.
Yeah, exactly. So the World Health Organization, they started with a list of more than 50 diseases, pathogens that are emerging infections. And they narrowed that down to 11 diseases. And what CEPI has done then through good evidence collection and assessment by our scientific advisory committee is to narrow that down further to 3 diseases. It's MERS, the Middle East Respiratory Syndrome, which is a coronavirus and similar to SARS. It's Nipah, which is a viral disease spread in outbreaks in Asia, started in Malaysia, but also seen in Bangladesh and other countries. And it's Lassa fever, which it has, at least in 20% of the patients, more or less similar clinical outcomes as Ebola. So it's really a hemorrhagic fever with devastating impact and high mortality.
And the intention is to take 2 candidate vaccines against each of these through to the final possible stage that you can do before there's an epidemic.
Exactly, because what we can do is to test vaccines for they being safe and that they will give the sufficient immune response and see that they are promising. And we know we need more than one candidate to be sure that we succeed. And then when we have done that, we will put them on the shelf, and then they will be ready for kind of efficacy trials to actually really see whether they are protective during outbreaks and during epidemics.
Yeah. We have the very generous contributions today from Norway, from Japan, from Germany, from the Gates Foundation and the Wellcome Trust, plus the European Commission. That takes us to what, about $500 billion. What do we need, and who do we need to do it?
Yes, so currently we have now, based on the recent announcement today, actually, we have $540 million committed. In addition, we will partner with the European Commission that are committing around $250 million. We have assessed that we need $1 billion for our first 5 years to really advance these vaccines and also really invest in adaptable vaccine technologies that can make us ready on the unknowns and ideally be a plug-and-play model for faster and fast-track vaccination.
So these are vaccine technologies that you can adapt really quickly when something that we've never seen before emerges.
Yes, and ideally it would be based on genetic information on the new pathogens, and we can predict which part of the genetic sequence will be the best kind of immunogenetic kind of part of it, and then integrate that in an accepted vaccine.
Yeah. Finally, put this in the context of the Sustainable Development Goals. Why does this matter so much?
So epidemics are really devastating crises that impact societies, and they impact health, but they impact schools, they impact the social cohesion in society, large economic impacts both nationally but also internationally. Countries, have reductions in trade and travel due to epidemics, so it really see how all sectors really are impacted by epidemics, and that's why we need new vaccines for a safer world.
John-Arne, thank you very much indeed.
Thank you.